You are listening to Dr. Carlin Vickery from Fifth Avenue Millennium Aesthetic Surgery.
I had the privilege of attending and being on the symposium panel for the second annual Dubin Breast Center Fact versus Fiction Luncheon. The Dubin Breast Center is the center at Mount Sinai Medical Center, which is exclusively dedicated to the treatment of breast cancer in one place with all of the different physicians and modalities collected so that patients do not have to chase around to different areas of the hospital or the city in order to achieve both a diagnosis and treatment for their breast cancer. It is a unique idea which was spearheaded by Eva Dubin, who is a breast cancer survivor and felt that breast cancer needed to be treated in a holistic fashion so that the patients could have the optimal outcome. As part of this, the center is dedicated to informing the population about breast cancer and the current modalities of treatment. With that in mind, the Fact versus Fiction Luncheon was created. There is much written about breast cancer on an ongoing basis in the press, and this is a unique opportunity for people associated with the Dubin Breast Center to hear the insider information and the real information about some of the facts that are presented by the press as facts, but that in fact remain controversial. People that were invited to this luncheon included friends of the Dubin Center, the advisory board, patients, donors, and other interested parties. The symposium was held in New York City in a beautiful setting overlooking the skyline of the city on Park Avenue. The panel consisted of the experts of the Dubin Breast Center and included breast surgeons, pathologists, radiologists, oncologists. In addition, there were doctors who were discussing environmental health risks and factors for breast cancer, as well as complementary medicine and psychology of breast cancer. So it was a wide-reaching panel, and the uniqueness of this opportunity to have all of these experts discuss the entire treatment of breast cancer is a tremendous benefit for the education of the listeners. It was a privilege for me to be on this panel, and I think that for the attendees, they were able to hear the dialogue between, in my case, the breast surgeon and the reconstructive surgeon, about our decision-making process. Given that Angelina Jolie has been in the press recently, we directed our attention to the issue of nipple-sparing reconstruction, and Dr. Port reviewed for the patients, selecting patients who are candidates for nipple-sparing reconstruction. It is often confused that everyone can have this procedure, but there are patients who have cancers which are close to the nipple and areola complex, in which this would be a poor choice. We were able to explain between the two of us the advantages and disadvantages of selecting this type of surgery. And in addition, we were able to discuss the controversy of thick flaps versus thin flaps in the performance of mastectomy. Again, this is insider information and isn't well reported in the press, but it is critically important for patients in choosing surgery and ensuring that they have the optimal outcome long term. The conversation also talked about timing of surgery with regard to oncology and radiation and how this impacts the treatment options and the length of the reconstructive process. I think anyone who attended this luncheon came away with a deep understanding of the complexities of successful breast cancer treatment and reconstructive treatment. And most importantly, they came away understanding that in order to achieve the best outcome, a patient needs to be with a group of physicians who work together to achieve the optimal result. It is a privilege, as I said, to be included in this panel and with such elite colleagues, and I look forward to more of these educational opportunities in the future.
Visit us on the web at fifthavesurgery.com.